St. Luke's Magic Valley is facing a daily struggle of being at or near full capacity as case numbers surrounding COVID continue to rise. The hospital is being forced to make some real changes. Idaho News 6 healthcare reporter Alex Grant has details on what the hospital is experiencing and the changes being made.
Averaging between 150 total patients a day, St. Luke's has nearly 50 COVID patients, making up for around 30% of all patients. Limited staffing is one of the primary factors for capacity since there is not enough hands to help.
Can you staff your hospital to the level that you would normally be able to? And the answer is no, we can't. Yeah. So, I mean, that's sort of the fundamental answer is no, we can't staff our hospital as well as we would want to for the volume of patients we have.
The average patient remains in the hospital for 2 to 3 days, while COVID patients are averaging 7 to 10 days. Oxygen is the standard treatment right now since the bulk of patients are having shortness of breath. The hospital is experiencing 1 death a day with numbers growing in the ICU.
I think we have something like 6 ICU COVID patients right now. Yeah.
Okay.
And that's our normal ICU census. Our ICU is usually staffed for around 6 ICU patients at any given time. So we have several other ICU patients on top of that.
Now that the South Central Public Health District has put multiple counties in the red critical risk level category, the hospital is anticipating more patients and has decided to suspend activity in its pediatrics ward.
Because, again, of our concern about staffing and just physical space, we're probably going to be preparing our pediatric floor to overflow with adult patients if we need to.
With daily capacity changing due to deaths and patients being discharged, the hospital has been going back and forth with diversion. This forces them to transfer incoming patients elsewhere.
Our, backup system right now has been Boise, and we've been able to transfer patients that have needed it up there. For other problems like trauma, so if a patient needs to come in the hospital for having been on trauma, we'll transfer them to another trauma facility.
With transfers going to Boise, if they were to be at full capacity, St. Luke's would have to look at alternative options both in and out of state. In Twin Falls, I'm Alex Grant, Idaho News 6.